Okay, hello everyone. This presentation will focus on asthma-related public health data sources. My name is Sarah Wakai, and I'm an assistant professor at UConn Health Center for Population Health. I'd like to acknowledge the leadership of the Technical Assistance of Brownfields program for Region 1, Dr. Randy Mendez and Dr. Marissa Crisocho. The learning objectives for this presentation are characterize asthma risk factors and symptoms, review research on environmental exposures and asthma rates, and explore data sources that monitor asthma rates in TAB Region 1. Okay. Asthma is a chronic health disease that can cause breathing problems throughout a person's lifetime and is characterized by repeated episodes of wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. As you can see on the slide, the lungs of people with asthma react to triggers such as allergens like dust, mold, pollen, and pet dander, as well as viruses, tobacco smoke, air pollution, exercise, stress, and other factors. With asthma, there are three changes in the lungs. Swelling and irritation causes the airway to narrow. Increase in mucus production clogs the airway, and a constriction of muscles around the airway reduces airflow. There are several studies that suggest a correlation of residential proximity to brownfield sites and increased asthma rate. However, a direct causal link is limited in many situations. Communities near brownfields tend to have multiple public health issues, including increased proximity for exposure to harmful chemicals from many sources, decreased access to healthy foods, poor air quality, elevated blood lead levels, as well as an increase of asthma rates. In a meta-analysis of 12 studies on respiratory illness, results suggested that living near stationary sources of air pollution, such as industrial sites, hazardous waste sites, petroleum refineries, and heavily trafficked road, was significantly associated with asthma hospitalization. Here's an overview of asthma prevalence based on the 2021 Behavioral Risk Factor Surveillance System data, which is abbreviated as BRFSS. At the national level, 77% of respondents answered yes to the question, have you ever been told by a doctor or other health professional that you had asthma? And do you still have asthma? As you can see, all of the states in Region 1 reported percentages that exceed the national prevalence rates. This is a table highlighting asthma data sources for each of the TAB Region 1 states. The available data, state data, typically reports prevalence, ED visits, and hospitalizations at the state and county level. Connecticut drills down to the census tract level. And in the next several slides, I'm going to review each state's website in alphabetical order. Since this presentation is recorded, you can advance the recording to your specific state if you like. Right. I'm going to just pause here for a second so then I can take you to the websites specifically so you can take a look. So hang on one moment, please. Okay, so this is Connecticut's website. It's a very extensive and informative website for asthma surveillance and epidemiology. If you click on the link, you will see options for statistics, reports, data briefs and fact sheets, maps, and data links. The statistics option takes you to Excel spreadsheets. The data sources are from the BRFSS and hospital data, and details on the data sources are in the technical Notes tab. The reports option provides several informative reports. For example, if you click on the Connecticut School-Based Asthma Surveillance Report 2021, you'll be able to access a report that provides information on asthma prevalence by demographics, district reference groups, and school districts. The data briefs and fact sheets option presents information in a user-friendly format that can be shared with community members. Keep in mind that some of the items are a bit dated. The maps option provides several maps. One that may be of particular interest to you is the asthma burden ED visits rates at the census tract level. So let's see if we can pull that up. There you go. So you can, the asthma rates by census tract and town options highlight health disparities and are color coded. For example, the majority of census tracts in Hartford have ED asthma rates into the hundreds. As you can see because it's color coded, you can go here and see the rates there off to the left. And just a few towns over in Avon, the census tracts are very low. The census tracts have very low ED asthma rates. Okay, moving on to Maine. The Maine Tracking Network provides information on asthma related to ED visits, hospitalization, prevalence, town data, tables, and data info. This is an example of age-adjusted rates for 2016 to 2020 for both sexes and all age groups. This is an example of combining years to increase ends so results are not suppressed. The map illustrates which counties have higher rates. And if you compare years, you can see which counties have rates that are increasing or decreasing. Okay, and moving on to Massachusetts. So Massachusetts provides asthma information for pediatrics and hospitalizations. You have options for maps, tables, charts, CSV export, and a metadata, which is a report. This is, and then we can move here. And this is an example of a map where red arrows indicate communities with statistically significant higher rates. As you can see, they're the ones with the red arrows. Okay, let me just move that out of the way. And moving on to New Hampshire. So New Hampshire's data portal, you can see, you can select filters on the right and view asthma hospital visits by county, sex, year, and month. Maps and graphs are then produced. You can click on the arrows to enlarge particular graphs, and you also can get some additional information there. And this is Rhode Island. So Rhode Island provides a link to graphs that provide state level prevalence by year for adults and children, federal poverty level, hospital inpatient stays, and ED visits. You can just scroll through that. So it's mostly at the state level. Okay, and then looking at Vermont, this is Vermont's Department of Health. So on their website, you can access a surveillance page and the Tracking Asthma in Vermont. The surveillance page offers a Vermont 2020 scorecard, maps, reports, and data briefs. You can also click on the Tracking Asthma in Vermont for an overview of hospitalizations by county. You can also see health disparities maps with 2024 data. So this is the asthma prevalence in Vermont, also by demographics. So you can see like median household income, percent of population that is Black or African American, and population that identifies as LGBTQ plus. So that's pretty helpful. And then this is a whole report, asthma data pages. And this is all BRFSS data. Okay. So now I'm going to stop sharing that and go back to the presentation for a minute. Okay, there we go. Alrighty, let me just click through these because I walked you through the websites, the direct websites. All right, so I know that you've already reviewed the presentation on EJ screens, but just to give you a refresher, I wanted to walk you through the asthma indicator. Right. On the EJ screens, you can go to health disparities, then click on asthma, and you'll get, you can view a map of the Region 1 states. As you can see by the red coloration, all the states have, in Region 1, have census tracts or towns where rates are in the 95 to 100th percentile. However, large sections of Maine are in the highest percentile. And then this is an example. You can select a census tract to run a report. And the report provides information on demographic, environmental indexes, and other information. As a comparison, I selected one census tract in Hartford and one in West Hartford, which are bordered by red. Okay. And based on the health indicators portion of the report, you can see that in this Hartford census tract, the prevalence rate is 16%, which puts it at the 99th percentile for the state and the 99th percentile for the US. In the West Hartford census tract, which is just the town over, the asthma rate is 10.4, which puts it at the 30th percentile of the state and the 56th percentile for the US. Right, that sums up the asthma data sources for TAB Region 1.